Matt Hancock had been the subject of quite a lot of criticism generally, as have many health ministers around the globe, dealing with this unprecedented health situation. The pandemic, of course, brought many challenges, but there were certain criticisms of him and the government that were beginning to have an effect on his position. Most importantly, the original plan for PPE, protective clothing, for those in the front line against the pandemic early on, and also the policy of the government in terms of returning some elderly people from hospital back to care homes without properly testing them. And that, of course, resulted in the spread of coronavirus in some of those care homes with fatal consequences. And now, of course, he's resigned purely because of this leaked video of him having an affair. Not necessarily because of the affair itself, that he said he'd prefer to keep private, though he may struggle to do so, but because the video shows him clearly breaking his own social distancing rules. Some are saying that it took far too long for him to resign and he should have done it immediately on Thursday or Friday. The Sun newspaper originally contacted him on Thursday evening, saying they were going to publish the pictures the next day. There are many other questions as well that need to be answered, such as how was this footage leaked to the tabloid newspaper? Apparently, according to a report in today's Times of London, the footage could come from a camera hidden in a smoke detector in the minister's office, which of course then brings about a lot of questions about how safe ministers are, even in their own offices, from the potential of being spied on not just by the tabloids, but by other states as well.
Now, stepping away from that side of the controversy, about what's the status of the country's coronavirus fight? We understand restrictions not lifting yet.
Well, the new Health Secretary, Sajid Javid, who resigned only around 16 months ago as the Chancellor of the Exchequer, the head of the Treasury, will have a lot of challenges ahead of him in his new role. He is going to have to deal with the ongoing COVID pandemic and the ongoing mass vaccination program. He has to deal with the backlog of health service issues, such as the lack of operations, diagnoses, and even cancer treatments for people because that's been delayed by COVID-19. But the Health Secretary will be enjoying the benefits so far of the mass vaccination program. The UK has recently caught up with and overtaken Israel's impressive record in terms of how much of the population has been vaccinated. And over recent days, that effort has been accelerated. And now the population has 4 in 5 adults who've had at least one dose, and 60% will have had both. Around half of all under 30s would have received at least one. And there are now mass pop-up vaccination centres where people can queue to get vaccinated. Of course, this is a race to July the 19th, when the government is hoping to lift the remaining restrictions on people's lives. They were going to do that during June, but then postponed it and tried to accelerate the vaccinations in order to get there sooner. With the Delta Plus variant still in the UK and still unanswered questions about how well the vaccine protects against it, they say so far that it does, and whether or not it causes serious illness, those questions still remain, which means that things are still relatively uncertain, but the government will be hoping to unlock by that date in July, if at all possible, supported by the evidence and the data.